On this week's Cardiology Countdown, we have two papers that look at severe angina, one prognosis, another potential treatment, and a look at whether fluid and sodium restriction will help in treatment of acute decompensated heart failure. So first up, we have a prognosis study that's done out of the Minneapolis Heart Institute of 1,200 patients of those who have severe refractory angina no longer able to be revascularized. A cohort that they followed for an average of 5 years and found a pretty adverse prognosis of this patient population. About 3/4 of the patients were male, about 3/4 also had undergone coronary bypass grafting, often with supplemental PCI that follows. They found that overall 20% of them had died, with Kaplan-Meier event rate of about 4% at 1 year and 28% out through 9 years. And so a pretty adverse prognosis of this group of patients where hopefully new treatments can help prevent cardiovascular death. Next up is a randomized study also of patients with angina, not quite so severe, but looking at a novel therapy, an SSRI treatment to try and go after mental stress-induced myocardial ischemia. This was a randomized trial published in JAMA, the REMIT trial, that randomized about 60 or so patients, actually 64 in each group, so a total of 125 patients, looking at an SSRI versus placebo over a 6-week period. And they induced myocardial stress with calculations and a questionnaire, and then monitored electrocardiograms and LV dysfunction with an endpoint that was pretty rigorous, a worsening of regional wall motion abnormality, worsening of ejection fraction of 8% or more, or having 1 millimeter or more of ST depression in 2 or more leads. They found at the end of a 6-week treatment period with a serotonin release inhibitor that there was a reduction in myocardial ischemia, so that the percentage of patients who were free of stress-induced myocardial ischemia doubled from 27% up to just over 50% of the population were ischemia-free in terms of mental stress-induced ischemia. These results obviously would need to be duplicated. Overall amount of ischemia was not significantly different, but the mental stress-induced was. And so opens up, I think, a new avenue for potential therapy of ischemia. And our number one pick this week is also a randomized trial. This is in the JAMA Internal Medicine Journal that looked at whether sodium and fluid restriction in patients who are admitted to the hospital with acute decompensated heart failure would help in improving in weight loss and potentially in rehospitalization. This was a modest-sized trial, just 75 patients, where they used a pretty intensive regimen of fluid restriction down to just 800 cc's per day of fluid and 800 milligrams of sodium in the diet. That was compared with a standard cardiac diet, they then looked at how much fluid was diuresed over a 3-day period. And interestingly found no difference in the ability to diurese fluid off and have patients lose weight, but did see an increase in thirst. Then when they looked out at 30 days, they didn't see a significant difference, but actually numerically higher rates of rehospitalization in the group that had been managed with intensive sodium and fluid restriction inpatient. And so they conclude that that strategy really was not helpful, albeit a modest sample size. And so the focus can be on the diuresis side with some fluid restriction, I'd say, but intensive fluid and sodium restriction in that early phase didn't appear to be helpful. So for this week's Cardiology Countdown, I'm Chris Cannon.